Welcome back to Weekly Neurology Deep Dive. This time we're going deep on tirofiban in stroke treatment. As always, this deep dive is for educational purposes only, and we have no commercial affiliations. We'll be breaking down a couple of key papers today just to give you a concise overview. But remember, for the complete picture, you'll want to check out the original sources. We're focusing on the data today and what neurologists like you need in their daily clinical practice.
Sounds like a good plan. A significant number of stroke patients, around 30% who undergo endovascular therapy, don't achieve reperfusion. So restoring that blood flow is critical.
It really is. And that's where this tirofiban comes in. I was thinking of uh, you know how blood platelets are like these tiny little puzzle pieces
hmm
and they clump together to form those clots? Well, tirofiban, it's like a puzzle piece blocker. It stops them from sticking and forming blockages.
That's a great way to think about it. It's a glycoprotein Abellia inhibitor. It falls under that antiplatelet category of drugs, and it's being investigated because it could potentially stop new clots from forming. But it might also be able to address something that we see with procedures like mechanical thrombectomy.
You mean sometimes with those procedures, they can actually trigger more clotting?
Yeah, exactly. The procedure itself can sometimes cause more platelets to clump together, and that leads to reocclusion.
So let's dive into the research then and see what the data says. This first study we're looking at is a meta-analysis of 7 randomized controlled trials. It was published in Clinical Neurology and Neurosurgery back in 2023. They had over 2,000 patients involved. That's a pretty good sample size to work with. So what were the main takeaways?
Well, the most impressive finding was that after 90 days, patients who got the tirofiban treatment, they were significantly more likely to be completely symptom-free. They saw a real jump in patients achieving an MRS score of 0. And remember, that means no symptoms at all.
That's really impressive. But of course, we have to look at the short-term effects and any downsides.
Of course. The study also showed improvements in neurological function, even in the short term. After just 7 days, patients on tirofiban, they showed a decrease in their NIHSS scores, meaning their neurological deficits were less severe. But there was a bit of a trade-off.
You're talking about the increased risk of intracranial hemorrhage, the ICH.
Exactly. Tirofiban did lead to more instances of any type of ICH, but we have to be very clear here. It did not significantly raise the risk of symptomatic ICH, so that's the bleeding that causes noticeable symptoms, and it didn't increase the risk of death within those 90 days. So yeah, there's that bleeding risk, but you have to weigh it carefully against the potential for some really impressive functional improvements.
Sounds like that classic risk-benefit analysis we always have to do. Now, this next article is a commentary from the European Journal of Neurology. It came out in 2025, and it looks at whether tirofiban might work better for specific types of stroke.
That's an important point. They dug into the data from the Rescue BT trial. And overall, tirofiban didn't show a big benefit for the primary outcome, which was functional recovery at 90 days. But when you start looking at it by stroke subtype, things get really interesting.
Meaning that for certain patients, tirofiban could be even more effective than we thought. Tell me more.
Well, for patients who had a large artery occlusion and high NIHSS scores, specifically those scores over 13, tirofiban was linked to better outcomes. It suggests it might be especially beneficial for those more severe strokes that are caused by blockages in those bigger arteries.
So not just the severity of the stroke, but the location of the blockage matters too.
Absolutely. And even more intriguing, they found no benefit for patients who had cardioembolic strokes. And that was regardless of their NIHSS score.
So if the stroke originated from a clot that traveled from the heart, tirofiban didn't seem to make a difference. This just shows you how important it is to really personalize treatment, doesn't it?
Absolutely. Treatment decisions need to be made for each individual patient, and that includes considering not just how severe the stroke is, but also what caused it and where that blockage is.
Makes sense. This commentary, it offered some insight into why we might be seeing these differences, right? Like in those cases of large artery occlusion, where tirofiban seems to be really helpful, those clots, they tend to be more stable, don't they? The idea is that tirofiban might be doing more than just preventing new clots. It could actually be improving microcirculation around the clot itself.
That's right. And that improved blood flow in those tiny vessels around the blocked area could be the key to saving brain tissue that might otherwise be lost.
So it's not just about breaking up that main blockage. It's about making sure the whole surrounding area gets the oxygen and nutrients it needs to survive. But when it comes to those cardioembolic strokes, the clots themselves are often different, aren't they?
They are, yeah. They tend to be softer, more likely to break apart, which also makes them more likely to cause problems in other areas. The concern with tirofiban is that In those cases, its anti-clotting properties, they might actually interfere with the natural healing process in the blood vessels, and that could even increase the bleeding risk.
A double-edged sword, then, in those specific cases. So for neurologists out there who are dealing with these situations every day, what does all this mean for them in their clinical practice?
It really underscores the importance of staying current with the research and being aware of these subtle differences. Treating stroke effectively, it means looking at the whole picture. How severe is the stroke? Where is it? What type of stroke is it? And what risk factors does this individual patient have? We can't just use the same approach for everyone anymore.
Right. And this meta-analysis, it did mention that more research is needed. What areas should future studies focus on to really get a solid understanding of tirofiban's efficacy and safety?
Well, long-term effects are a big one. This study looked at 90 days out, but what we really need is data on how these patients are doing over several years. Do the benefits last? Do any long-term risks appear?
I see. What else?
Dosage is another crucial question. We need to figure out the optimal dose of tirofiban. How can we get the maximum benefit while also minimizing that bleeding risk? Too much, and you increase the risk of bleeding, but too little, and the treatment might not work.
Finding that sweet spot is crucial.
It is. And finally, we need head-to-head trials comparing tirofiban to those other antiplatelet medications that we're already using for stroke. That will give us a much clearer idea of where tirofiban fits into the treatment landscape.
Seeing how it stacks up against the existing options.
Exactly.
It's really interesting to see this research diving deeper into those nuances of the different stroke subtypes. It feels like that's where the real breakthroughs are going to come from.
I agree. The more we understand about the specific mechanisms that are happening in each subtype, the better we're going to be at developing targeted and effective treatments.
And at the end of the day, that's what it's all about, improving outcomes for our patients.
Couldn't agree more.
So where do we go from here? We've covered a lot today, but it feels like we're just scratching the surface when it comes to understanding how complex stroke really is and what role tirofiban could play in treatment.
I think that's a fair assessment. One of the biggest takeaways from this whole discussion is that stroke is not just one thing. It's incredibly complex. It has so many different facets. And how well any treatment works, including tirofiban, it's probably going to depend on a lot of factors. The stroke subtype, how severe it is, the individual patient's characteristics, and more.
So are we moving into a new era of truly personalized stroke medicine?
I think we are. There's still a lot to learn, but the research we've looked at today shows that we're making huge strides in understanding stroke, and we're developing exciting new treatments.
It really is a remarkable time to be working in neurology.
I couldn't agree more. The future of stroke care is incredibly promising.
Absolutely. And speaking of staying engaged, for our listeners out there, be sure to check out the full articles we've talked about today. You can find all the citations down in the show notes. There's a lot more detail in those papers that we just didn't have time to get into, and they're definitely worth a read.
I second that. Those papers have a ton of great information.
Now, before we go, I wanted to leave you with something to think about. We've talked a lot about stroke severity and subtype as being these key factors in how well tirofiban works. But I'm wondering, could there be other things we haven't even identified yet, that also affect how well it works for individual patients? Like maybe genetic predispositions, or even how it interacts with other medications they might be taking.
That's a really good point. Those are definitely areas that need more research. As we get more data, I think we'll start to get a much better understanding of exactly how tirofiban works. And that'll help us figure out who's going to benefit the most.
And who knows, maybe we'll even discover some new biomarkers or predictive tools that can help us make treatment even more personalized.
That's the exciting part of all this stroke research. There's so much potential.
Well, that about wraps up our deep dive into tirofiban and its possible role in stroke treatment. We hope you found this discussion helpful and that you can use this information in your practice.
It's been great exploring this with you.
And to all our listeners out there, be sure to tune in next week for another episode of Weekly Neurology Deep Dive, where we'll keep digging into all the latest discoveries and thought-provoking questions in neurology. Until then, take care and keep those brains active.